consist of, under both the House and Senate versions of the bill, would consist of a chair and 4 members. The chair salary is set at $116 and change, and the other members are, yes. And the other members are set at 77, I believe it is, 77,000, and they would be state employees, so they also get state benefits. The idea with this board is, well, you want to make sure you have a proper vetting process up front and an open, transparent process for appointing them. You also want them to have some independence and not be subject to pressures either from the executive or the legislative branch, and have the ability to make some of these policy decisions and do the kind of weighing of major policy considerations that Mark talked about with some independence. So they can be removed for cause, but not for just any old reason.
And I think the beauty of what the board is going to be doing in making some of the hefty decisions without being subject to political influences is that it will be an open, transparent process with a lot of opportunity for people to provide input and opinions as to the kinds of decisions that the board is making.
And at the same time, the board only has the duties that are delegated to it from the legislature. So if the legislature doesn't support its decisions or wants to modify its duties, the board is always subject to the potential that laws will be passed to limit its duties or to change its decisions. So it is also accountable in the fact that at any point, the legislature can pass a law to second-guess its actions or to limit its scope of responsibility.
How much will the legislature be involved in formulating the actual structure and funding sources as this process moves along? Do they have many opportunities for input along the way?
I think we have to understand that when we're talking about Green Mountain Care, we're talking about the end product. Oh, the timeline's not up there anymore. And there are a lot of decision points along the way where the legislature absolutely has to intervene. But suffice it to say that there will be a lot of legislative input into many of the decisions that have to be made.
One of the things that I think we have to be careful about is that one of the ways to derail progress is to make people afraid. If you hear folks talking about wild things that the board could do, it is very likely that they are just that. They are just wild things that people are saying that the board could do.
We have had community rating, BHAP, and Catamount. Each one has been unsuccessful in controlling healthcare costs and covering Vermonters. Why do you think throwing more and more government control is going to make the system better? Why not change the direction and try something which would give individual choices and patient control of their health care?
But for essential health care choices, there is no evidence that competition and choice bring down overall systemic health care costs.
So, no, the last question is not true. The only specific financing proposal that's been put forward is the one done by Dr. Shao under the study commissioned by the legislature, which was released in January. And he proposed a payroll tax that was split between employers and employees, so it wasn't shouldered entirely by employers, it was a split. The legislation requires the administration to come back with a specific financing plan in 2 years for financing Green Mountain Care. And one of the issues there is that probably it will have to be a mix of financing mechanisms in order to assure that kind of sustainability and to assure that whatever financing mechanism we use is not so volatile that it could have real detrimental effects on the healthcare system if we rely on a single tax that in 1 year could take a dive. And how do we spread it equitably? So how do we make sure that everybody pays and pays fairly in terms of their income and their health risks and all that, those other factors that tend to go into the calculation of coverage now. And in terms of the IBM situation, federal law actually under current federal law, we have no ability to dictate that they be in our system. We do have the ability to broadly raise taxes for coverage in Vermont, and you've probably heard some talk about that because there's a fear among those self-insured employers that we'll tax them and they'll still provide health insurance. And that is just one of many details that we're going to have to address in terms of the details of the financing. In terms of Medicare, what we've said is that we would not provide coverage that is less than what you get through Medicare, through Green Mountain Care. So that's sort of the litmus test for Medicare. We have to do at least as well or better than what Medicare currently provides. And Medicare coverage, frankly, isn't that great for a lot of people. It requires a lot of cost sharing. It doesn't cover the full scope of services that you would hope good insurance would cover. So there may be the opportunity under Green Mountain Care to provide better coverage to Medicare beneficiaries, but we will not provide lesser coverage. And that's one of the issues that we're going to have to look at is how much flexibility might you get from the federal government to include Medicare and to enhance Medicare benefits, and what's the financing look like in terms of the opportunity to do that. We will have to make some accommodation, as we do now with Medicaid, for people to get services and pay for those services when they're out of state. That is an issue that will be determined in part by what the benefit package is set as. So if you set the benefit package as a less expansive package, then the need for outside benefits would be greater. But frankly, that undermines a lot of the goals that we're trying to achieve in terms of having a unified, universal system. So the goal would be to try to minimize the need for that, both so that we can assure that everybody has adequate coverage and to reduce complexity.
We have a basic process right now called the Certificate of Need process, where investments in those kind of technologies are considered so that we don't invest in things that are going to add cost to our healthcare system if we don't really need them, to make sure that they're in the right place so that we're not investing in two super special machines right next to each other, so that we just have them both frankly trying to compete for the same people to be able to pay off the bills. So that basic process for reviewing our technology investments is similar, except the board has a role in making sure that on a statewide level that makes sense.
The charge that's set out to the board is to provide evidence-based coverage. So I think that's really the test for any kind of therapy, whether it's alternative therapies or high-tech therapies that become available over time. The board will have to look at the evidence that backs up the efficacy of those therapies and say, is it proven? Is there a real proof that this does what people say? And is it a wise use of our resources to cover it?
You save the most money when you reform how we pay for healthcare and how we fund healthcare. Because when you simplify the financing, you maximize the ability to use payment reform to change the delivery system, where we then have the system that has the greatest ability to have less administrative cost and be paying for quality as opposed to volume.